As we age, our tear production slows down. If the lacrimal gland does not make enough tears, then you will have a problem with the tear quantity. And also, if some of the glands are affected, such as those which produce oil, then you will have a problem with the tear quality. Since you need all the three components, that is mucin, oil and water, for the tear film, which is one of the most essential components for a healthy eye, and if any of these three components have an issue, then you will have dry eye syndrome. Now this includes symptoms such as burning sensation, grittiness in the eye, discomfort, visual disturbances, redness of the eyes, burning sensation, feeling of dryness and soreness in the eyes, discomfort and difficulty in wearing contact lenses, sensitivity to light, blurred vision, sand-like feeling in the eyes, eye fatigue, watering of the eyes, difficulty with night driving, itchy eyes, and also instability of the tear film can lead to optimal damage of the ocular surface. But it's not just aging that causes dry eye syndrome, there are other causes as well. Eyes have it all, so it is our responsibility to take care of them. In Ayurveda, there are natural ways to take care of the eyes. So in today's video, I'll be talking about dry eye syndrome and how it can be treated and managed in Ayurveda with different treatment modalities mentioned in the classical texts. It's pretty interesting, so do stay tuned. But before we get into it, for those of you all who are new here, hi, I'm Dr. Smriti Valsan. Do watch my videos, and if you did like them, then please don't forget to hit that subscribe button along with the bell icon right next to it so that you get updated with all the latest videos on Ayurveda. And with that, let's get into this. Tears cover the surface of the eyes to keep it moist and wash off dust, debris and microorganisms that may destroy the cornea and lead to an eye infection. Normal and healthy eyes are always covered with a fluid called as a tear film. The tear film stops the eye from becoming dry and enables clear vision. There exist three main components in the tear film, that is the outer oily component, the middle watery component and the inner mucus-like component. The meibomian glands in the eyelids are where the oily component is produced. The lacrimal glands that sit behind the outer part of the upper eyelids are where the watery component is produced. The mucus-like product is produced from the goblet cells. Problems with any of these components can lead to dry eye syndrome. And it is a condition where your tears are unable to sufficiently act as a lubricant and moisture the surface of the eyes. Dry eye syndrome can happen at any age and in people that are healthy. However, it is more common in older people. The syndrome is also more prevalent in women than in men. An insufficient secretion of oil or sebum from the meibomian glands can cause tears to evaporate more rapidly and can cause dry eyes. This may be due to the blockage from the inflammation along the edge of the eyelids and some other skin disorders. In some other cases, the lacrimal glands may fail to produce enough watery fluids to keep the eyes adequately lubricated and moisturized. Some medications such as antihistamines, decongestants, birth control pills, some sleeping pills and drugs for high blood pressure is also likely to cause a dry eye. Certain medical conditions mentioned below can also cause it. Climatic factors can also cause this problem. Taking care of dry eyes not only helps relieve distress and discomfort, but it also helps prevent infection and even scarred corneas. The treatment principles are pretty simple too. So for the people who are having dry eyes, do resort to warm compress, instilling artificial teardrops, and also instill medicines that help in the production of tears. In Ayurveda, there are different therapies involved in treating dry eye syndrome. Now, the therapy is selected based on the condition of the patient, and only after examination is the right treatment protocol planned. In today's video, I'm going to show you guys a glimpse of all the therapies which are usually done in treating dry eye syndrome. Now the therapy varies based on the condition of the patient. It's not that you have to go through all the therapies. It always depends on the chronicity of the ailment. So let's have a look. One of the therapies used to treat dry eye syndrome is a therapy named as Akshi tarpanam. To do this therapy, a dough is prepared by using black gram powder, and that is made into the form of a well and it is placed over the eyes. Once the well is placed over the eyes, medicated ghee is put into the eyes and the patient is made to blink, allowing the medicine to get absorbed into the eyes. Tarpana stimulates the lacrimal glands to produce tears. Mucin layer present in the tear film allows the ghee to spread over the ocular surface, thereby reducing dryness and burning sensation. Vitamin A, vitamin E and beta carotene present in cow's ghee are helpful in keeping the ocular surface healthy and thereby helps in treating dry eyes. If you want to know more about this therapy in detail, I have already put a video in my YouTube channel describing about the benefits of doing tarpana, and also there's a detailed description about the procedure. I'm going to link it somewhere over the screen. You guys can click it and have a look. This is a wonderful therapy. You guys can try it out as it has a lot of benefits and can be used by a normal healthy individual as well. There is another therapy called as Akshi seka. Now this is also a treatment used to treat this condition, wherein the patient is made to lie down, slight massage is done around the eyes and the medicated decoction is taken and poured over the eyes from a height of 6 centimeters in a thin and continuous stream for the prescribed period of time. The benefits are that it nourishes tired, dry, rough and injured eyes. It strengthens the nerves and muscles around the eyes. It gives freshness to the eyes and eliminates toxins out from the eyes. It sharpens vision, and the best part of it is it improves the blood circulation around the eyes, thereby stimulating all the nerves present over the face. Ayurveda also adds on another beautiful therapy called as Anjana karma. So this is one of the major therapies done in treating such conditions. Now I am going to make a detailed video on this in my next video, so please do stay tuned. And this is nothing but medicated kajal, which is prepared by preparing medicated ghee. And what we do is, once the kajal is prepared, it is taken mixed with the medicated ghee and it is applied over the inner canthus of the eyes. Now there is another interesting therapy called as Pindi karma. So over here we make a kiri with different herbal ingredients. So the ingredients which I have used are navara, trifala, yashti madhu and so on. So we cook it and we tie it in a potili, and that is dipped in lukewarm medicated milk and it is fermented around the eyes. So continuous fermentation is done for the stipulated period of time. So this also helps to improve the blood circulation and it activates all the glands which is present around the eyes, thereby sorting out or treating conditions like dry eye syndrome, and also it helps to rectify dark circles. Now I have also made a detailed video on this. I will throw it up on the screen. You guys can have a look about this interesting therapy. Now one of the other therapies which is done in Ayurveda is a therapy called bidalaka. So it is nothing but a herbal paste is placed or it is put around the eyes. So over here, since it is a strong medicament, what we do is we put a kora cloth over the eye and the medicine which is prepared is put over the eyes. So again it is placed over the eyes for the stipulated period of time, and after which we remove the paste from the eye. So this also helps in treating different eye disorders, and one of the disorders which is rectified using this therapy is dry eye syndrome. So this works wonders. So this is also pretty interesting, and also a detailed video is made over this therapy. If you guys are interested, then I'm going to again throw it up on the screen. You can go and check it out. Depending upon the chronicity of the ailment, the medicine is prepared. Now the medicine also differs. So over here the main ingredient is neem, so this also helps in treating conditions like blepharitis, and also it helps in treating any sort of eye infections. So one of the major treatments in treating dry eye syndrome is a therapy called as Nasiya karma. So over here we use medicated ghee or medicated oil, and that is taken and it is put into the nostrils. Now this helps in activating the glands which is present in the eyes, that is basically the lacrimal gland. And the medicine also which is used as nasal drops has a lot of properties which helps accelerate the process of lacrimation. And one of the other major therapies is a treatment called as Viresona karma. Now a detailed video is made on this as well, you guys can have a look, wherein the medicine is taken orally and it helps detoxify the entire body. Ayurvedic therapies helps activate the gland to ensure proper secretion for moistening the visual organ. It helps the eyes undergo thorough rejuvenation and is made healthy so that the natural mechanism of tear production is restored. Ayurvedic therapies or Ayurvedic eye drops, that is nothing but medicated ghee, can be used in place of artificial tears to restore moisture in the eye and also increase the production of tears naturally. So in my next video, I'll show you guys a glimpse of how I treat my patients suffering with dry eye syndrome with the medicines I prepare for them. It's pretty interesting, so do stay tuned as it's going to be featured up next week in my YouTube channel. I hope this video proved to be informative and useful to you guys. If you guys liked it, then please don't forget to like, share and subscribe, and I'm going to see you guys very soon in my next video. Till then, stay tuned and thanks for watching.